If you're not familiar with this story, I've shared it with you many times in these podcasts that there have been several variants of the virus that have been found in other countries. And there's one particular one that is going around in the UK and then in South Africa that is particularly bad in that it spreads more aggressively. I haven't seen any research as to whether or not you have greater symptoms, whether or not the death rate is higher, or anything like that. Just that it spreads much faster. And so the question is, there were a lot of people who said we need to shut down travel. And even Dr. Fauci said, no, we don't need to do that. And that it's probably already here. Well, now we know. Guess what? Congratulations. It is here.
News in the coronavirus pandemic. The new strain of COVID is now in the U.S. Health officials in Colorado say they discovered a case of the same variant that was previously found in the U.K. They say the patient is a man in his 20s and is being isolated. He has no travel history. Experts say this coronavirus variant may spread more easily. This is the first known case in the U.S.
So it is here. I didn't hear any reporting or see anything about whether or not many people have it or if it's in other states, but you can bet that it is and that it will travel. Now, the good news here is that I know that we're used to thinking, like with the seasonal flu, that they have to come up with a new vaccine every single year for the seasonal flu. And so many of you are thinking, oh, great. If there's a variant on COVID, does that mean that the current vaccine that's been developed, does that mean that it's not going to work? Well, everything that I've seen and all the research that I've read says that this vaccine should work on the variant as well. And the reason for that is because this is a different type of vaccine. This is an mRNA vaccine as opposed to the other types of vaccines that we're used to. So if I can explain this quickly, and I know I've explained it in previous podcasts, but maybe you missed it. You know, previously, and what they would do is they would take a dormant version of that virus, and that would be the vaccine, and they would inject that into your system. Your body would recognize it and develop antibodies to fight it. And then when the real thing comes along, it recognizes it and it fights it. Well, this new COVID vaccine is not injecting you with a dormant virus. In fact, you're not getting the virus at all, which should be good news. You're getting an mRNA, which is basically an instruction to your body to create these proteins that will attack the little... I'm not going to use scientific terminology. I'm not good with scientific terminology, but you've seen the image of what COVID looks like, and it has all those spikes. It attacks the spikes on COVID. And even if there's a variant, COVID is still going to have that. And that's what allows it to attach and to grow and all that stuff. Again, Reader's Digest version. Consult an epidemiologist if you want to know the actual cold hard facts. But so basically... yes, the variant is here in the United States. And yes, the virus should be able to, the vaccine should still work with that. Are you guys seeing me on TikTok? Because I'm getting an error message. I'm just going to click refresh here and reload and see if I can solve that problem. I apologize for the delay. So does that answer your question, Grace, about the UK variant? I think that it's important to understand that it's here. It highlights the importance of wearing a mask and social distancing. And if you are somebody who still thinks that this is a hoax perpetuated on the American people, I don't feel that there's a lot that I can do to change your opinion about that. I would suggest that you look outside of the United States for what's going on in those countries, and then ask if this is a hoax perpetuated on the entire globe. And in that case, every world leader, every epidemiologist, every doctor, every nurse, every ambulance driver, every single person involved would have to be in on it. Grace says, yes, thank you. I answered her question. Thank you. This is, in fact, a nurse in LA. She's been taking to Instagram to just talk about what she sees every single day.
LA County emergency room nurse Tony Catano says her hospital is running out of oxygen tanks and space in the morgue.
Our morgue is full. It's only a matter of time before they start breaking out the butcher trucks.
Throughout the pandemic, she's used her social media to warn residents of what's to come if the current trend of COVID cases continues.
10 hours later, and there's still just as many ambulances. They don't stop coming.
Cases in the state have surged in spite of strict COVID-19 protocols, including a stay-at-home order.
Now, I've told you that my daughter, she is a body collector. She is the person that goes to the scene of an accident or to a home or to a hospital to collect a body for the mortuary. And she will tell you, and this is anecdotal, but she will tell you that they are doing 3 times the amount of pickups that they would normally, and that COVID-19 is to blame. And I know a lot of people still want to say that this is somehow a hoax, but I'm just sorry. It's just the level of involvement that there would have to be on every level of government and every level of healthcare. It's just, to think that you would choose to believe the hoax aspect with no evidence and versus the mountain of evidence and people involved globally, it's beyond me. It really is beyond me. And if you're believing that to what? Not wear a mask or not social distance? I don't know. This is Yao. Yao, are you saying BS? What are you saying BS to if you're saying BS? When you comment, I need you to be more specific so that I can, because we move quickly, we cover a lot of topics. If you can be more specific, I would be glad to address any claims or disagreements that you have with me. And by the way, Yao's on Periscope, so thank you for joining us. Here is another one. This is patients at Martin Luther King Jr. Community Hospital in Los Angeles. They've run out of room. And so they've found a way to get more people inside for treatment. They are placing their gurneys inside the gift shop, chapel, and the conference room. They already have 5 tents outside of the hospital to help with overflow. One of their head doctors, the CEO of the hospital, told the media that workers have been incredibly adept and flexible in accommodating increasing numbers of patients. But if the pace keeps up, they will have to start contemplating whether to ration care. This, she said, is something we really just loathe having to even think about. I can tell you that just near here, where I live, there is a drive-up COVID checkpoint. And for the longest time, I would see 2 or 3 cars out there. But after Christmas, the line goes out of the parking lot and down the street and around the corner. And it's been like that for 3 days straight. Now, that doesn't mean that every one of those people have COVID, but it does mean that they think that they might. Do you want to travel around the world a little bit? I mean, if you think that this is a hoax, a lot of people thought this was a hoax to get rid of Trump, or it's the Great Reset. Let's do a little global traveling. And again, to believe that it's a hoax, every one of these governments that I'm going to tell you about, they're in on it. Their epidemiologists are in on it. Their doctors, their nurses, their first responders, they're in on it. This is Professor Andrew Hayward of the UK. He says that they need tougher measures than already in place in England to deal with rising numbers of infections. And if you want tougher, the UK basically shut down for Christmas. They shut down their airports. They shut down travel. They put in very strict guidelines. Those guidelines are set to be reviewed again tomorrow. Hospitals in England are currently treating more COVID patients than at the peak of the first wave in April. So that's the UK. They must be in on the hoax. How about Spain? You want Spain? People in Spain who decline to be vaccinated against coronavirus will be listed in a new register. I love this idea. That will be shared with other European Union nations. This, according to the Spanish health minister. He says what will be done is a registry of those people who have been offered it and simply rejected it. This is frightening. They said they're not going to make the vaccine mandatory and that the information in the register would not be made public. So what are they going to use it for? I'm assuming their logic is that they're going to use it for contact tracing, to make contact tracing a little bit easier. But I guess Spain is in on the hoax as well. Should we go to Scotland? Scotland is looking at canceling an upcoming holiday for which I cannot pronounce. And let's see, they say a further 1,895 cases were reported on Tuesday, the highest number ever logged on a single day in Scotland. The whole Scottish mainland is in the highest level of restrictions in a bid to contain a new strain of the virus. Their Surgeon General said it is especially vital that people do not mix indoors with other households. Scotland's in on the hoax too. Now, some people who I don't trust, and they've been telling us that they essentially got rid of the virus, and that's where supposedly this virus came from. A new study tells us that in China, that a lot more people got this thing in Wuhan than they originally shared.
Yes, so Chinese authorities are saying that the scale of the COVID-19 outbreak in Wuhan, which was the epicenter of the initial coronavirus spread earlier this year, may have actually been nearly 10 times the recorded tally. That's according to the results of a study from antibody testing on Wuhan citizens done in April. Now, this ratio of those with coronavirus antibodies suggests that as many as 500,000 residents may have been infected, which would have been, nearly 10 times more than the 50,000 confirmed cases that have been reported at the time.
Yeah, so I'm not believing anything that comes out of China. But what about other nations that are fighting this? How about Indonesia? They must be in on the hoax.
Yeah, so Indonesia is the worst affected in terms of coronavirus case numbers in Asia, and so part of that, they've been signing a lot of vaccine deals. The government is set to sign an agreement with Pfizer in the first week of January for 50 million doses of the vaccine it developed with BioNTech. It has a similar agreement for the same number of doses with AstraZeneca that was announced this week. Those vaccines are likely to be delivered as early as the second half of next year. And again, when vaccination happens, it will prioritize healthcare workers in Indonesia.
Yeah, so they're scrambling to get the vaccine because of a giant hoax, right? What about Thailand?
Yeah, so Thailand had been doing very well in terms of containing the coronavirus, but there was an uptick in cases that began about 2 weeks ago when a seafood vendor tested positive for COVID-19. So in the last 10 days, the country has reported nearly 2,000 new cases, with infections reported in nearly two-thirds of the provinces in the country. Now, the government so far has refrained from imposing a broad lockdown, but is allowing kind of local authorities to set its own measures. So, for example, the capital Bangkok will be closing entertainment and sports venues for the next week as part of those measures.
So I'm just curious, if you believe this plandemic philosophy, why are countries doing this? Why would they be shutting down their economies? Why would they be creating mass unemployment? Why would they be ordering millions and millions of doses of vaccines if they're all in on the hoax? And what would be the reason for that hoax? To shut down their gross domestic product and virtually drive their nations into a recession. Again, anyone that believes the mountains and mountains of evidence in favor of evidence of this pandemic to throw that all away and to just call this a hoax, I would love to hear your reasoning if you want to share it with me. But again, as for me, I'm going to stick with the evidence. I'm going to stick with the overwhelming evidence. The nasty thing about conspiracies, especially ones that have to involve millions of people talk. I mean, so let's say, for example, that emergency rooms and ICUs across the country are not full of patients. You don't think nurses are going to come forward and say, we're just sitting around? You don't think they're going to come forward as whistleblowers? You don't think ambulance drivers are going to come forward as whistleblowers? You don't think doctors are going to come forward as whistleblowers? You don't think they're going to come out and say all these stories you're hearing in the media about our full facilities? They're nonsense. They're fake. Let me show you pictures. I'm going to take pictures and show you our empty rooms. Do you see any of that anywhere? No, of course you don't. I've seen people outside of the hospitals saying, where's all your people? And I've seen people saying that anytime somebody dies, that they assign that to a COVID death, which I've disproven that on more than one occasion, because we've had, if you believe the CDC, and if you believe the excess death numbers from every country out there, every country that has COVID is experiencing a higher number of deaths than their average years. We're experiencing over 300,000 more deaths than our average year. In fact, we just had our first year ever over 3 million deaths. Ever. First year ever that we've hit 3 million. But the crazy thing about that is deaths by accidents and car accidents and drunk driving and all of those things are going to be down because we're locked down. So how do you explain this incredible increase? That's above and beyond normal deaths that happen every single year. Again, mountains of evidence that this is real. That's why I think that if you're going to choose to go the other direction, I don't know how to help you. I don't know what to tell you. But if you want to share in the comments why you think that this is a hoax or it's overblown, and what is the grand plan for every nation on the face of the earth to be involved in it, and all their doctors and all their epidemiologists and everybody, what is the grand plan? I'd love to hear it. Even Trump would have to be in on it. Yes, even Trump. Remember, he shut down, he did the travel ban. He said millions of people would die if it wasn't for him. He takes credit for Operation Warp Speed and for the vaccine coming out so quickly. Yeah, even he would have to be in on the great plandemic. So what is the goal of that? Let me know. I'd love to hear it if you've got something.